All proteins are amino acids, so we want to be specific. The amino acids that are concerned with here are ones that contribute to overexpression of hormones. These are the ones that we usually are concerned with are tyramine, and the ones we talk about, tyramine, tyrosine, and histamine. And these are released in the aging process of foods, smoked foods, bananas. That's why you'll see bananas on the list. Things that soften, it's the aging process makes things soft. You can see my hands, I can't talk about my hands, but it makes the fruits soft. And avocados, they soften as they get older. Some people can eat a banana not on green, but on the greener side and not have trouble. If they wait till it gets too ripe, they'll see that. Smoked foods, because of the aging process.
Sure.
Those proteins start to break down. When they start breaking down, they form these things. I see problems with tomatoes have a lot of histamine. So sometimes with the tomato sauces, we'll see problems. Of course, pizza's kind of got everything in the world going wrong for them there. Even in this book, we came up with a good pizza. So, it's just altering things. It's just, it's changing things around a little bit. But pepperoni, aged meats are some of our biggest ones. Fish has a lot of histamine as it ages. Shrimp paste, we worry about that in Asian cooking, and down here in the South we use some of that. Leftovers can do it. I worry about leftovers. I try to get people as they cook to go ahead and put up the food in portion sizes and not leave it in the refrigerator for a day or so. Go ahead and have it. That way you can use it again, and you can use it again safely. But I've had some of that comes from listening to patients for years, and they'll be able to eat it fine the first day, and you wait it's in the refrigerator a day or two, and then they don't tolerate it. And so I do think that, of course, it will cause these amino acids. But it's not all amino acids. Proteins are amino acids. They're made up of amino acids. But it is the ones that produce an increase in the tryptophan and serotonin and histamine. Foods that are high in fat or have fats. Fats are going to be the biggest problem that you're going to have. And fats, if you're having nausea, fats stay in your stomach the longest of our food sources, so they can tend to cause a little bit more of a nausea effect. Fat malabsorption occurs with those medications, and if it gets worse, she may want to seek some help from her medical staff, or talk to her doctor about it and get medication that can help with that. Let me go with that one more thing. But on the fats, medium chain triglycerides like coconut oil. Okay. They're absorbable. They are saturated. I'm not going to say they don't do the heart disease and all that. We think they're better than we thought they were at one time. Right. But they are really good for this group of people that are having fat malabsorption or weight loss. So use your coconut oils. They're pretty easy to find these days. A trigger food that has the amino acids, or too much histamine, tryptophan, tyramine, which is going to trip your serotonin. Right. You're not going to change that. I mean, if you consume it and you're at the point where that happens, and you have enough, it's usually people that have larger amounts of tumor burden that having that effect. And so that's not going to do it. If it's allergies and things that are causing gas, we know that we've worked with diets such as the FODMAP. I've used that quite often in practice. It was put out to help reduce gas and the problems that we see with just GI discomfort. It was really really is a gas formation.
What was the name of that again, Leigh Anne?
FODMAP. It's the FODMAP. And that is the initials for fructooligosaccharides and
FODMAP works for me.
But it was put out by researchers out of Australia in 2010. And it put together foods that are less gas forming And it was put together on the same premises that we do elimination diets. And with that one, it has you stay off of foods for 30 days and then start working small amounts back in. And if it's for GI tolerance and for the gas, you can kind of reset some of the tolerances by staying off of them. Especially, sometimes we see that in wheat and wheat tolerances as well. But yes, you can do it, but not if it's a carcinoid syndrome type thing. I think that with some of the newer research that we've seen coming out of Europe this year, that probably the better you control your glycemic index, prevent hyperglycemia for people that have diabetes or metabolic syndrome, tend to do a little bit better. I think that the tumor size they've even found maybe a little bit different size. But with that being said, with that exception to for people that are just eating a lot of sugar in their diet, for the most part, sugar alone is not going to cause tumor growth. I don't think that that's not the issue. The issue is sugar causes you to dump. So it increases the motility of your GI tract. So the sugar usually in carcinoid syndrome is removed to remove the concentration of water being drawn to the GI tract and to the gut, which will increase your diarrhea output. So that is one of the biggest concerns in the sugar content, because we watch for numbers. So watch your labels. Try to keep your labels where you see carbohydrates on the label. Underneath that, you're going to see sugars. And this will be sugars that may come from milk sugar, which would be lactose. It may come from fruit sugars, and that would be your fructose. Or it may come from just cane sugars, what we see, table sugars. They're all listed the same, but it's going to give you a number there. And even for diabetics, we try to keep that number around 5. We say under 6 per serving. So things with a serving, we've never said no sugar. So that just kind of gives you an idea of keeping things down to where you're eating things under 5. That's fine. And everything else, just work in moderation. Watch your portion size. If it's something that you can eat a little of and be happy with, that's good. I am in the same situation. I've not worked in my house since 27 years have I been home during the day. And it's really hard when you have that kitchen in your office. It's hard to walk. I said my worst part is buying things for my grandchildren, and now it's in the house, which I never do. But in the quarantine, I help my daughter has 3 children, so homeschooling 3 children. I've had one of the grandchildren, and things I never have in my house. Yes. So one of the biggest things is try not to bring things in your house that you're going to get in trouble with. Think it out. Absolutely. Think it out. But a little bit of sweet is not going to be the downfall. Some people can curb a sweetness with vanilla wafers, just a little bit, graham crackers, things that we can use with, no problems. You can use that and use it as an item to dip, chocolate pudding with. So you can use a low fat, a low sugar pudding and make some little sweets like that. So you can alter things. But the overall thing is we're all going to make mistakes. But the reason is not for tumor growth. I don't want anybody to worry about that. I don't believe that there's enough research in any cancer to say that. It has to do with other mechanisms. But just to try to keep your blood sugars, if you're diabetic, under the best control you can, and do small portions so that if you get into something, it's not going to cause the diarrhea effect and the malabsorption. There are plant-based protein. Beans can be used. The dry beans, there's a few of them that are really hard on the GI tract. And those are red beans, black beans, and pinto beans tend to be harder. Down here in the South, we soak them and we cream them, and they're not so hard to consume down here. Of course, it also has bacon degrees and all that other stuff too. But if you can make that lean, but I have found that garbanzo beans tend to be tolerated pretty well. And so I have quite a few people that do well in the hummus, and I think we've done quite a few recipes and things like that using the pita and the hummus very successfully. roasted peppers to replace some of the some of the other things that we use as a good filler. Mushrooms have some benefits that are really wonderful for neuroendocrine because they are an absorber of vitamin D. And vitamin D is very important in areas of, just everybody. Okay, I'm going to say vitamin D is very important. No exception to oncology. Very important in oncology. Very, very important in bone maintenance. But it's hard to get people to drink milk, so it's always a problem with people that fat malabsorb because vitamin D is a fat-soluble vitamin to get a way that they can absorb it. So mushrooms, if you put them in your windowsill, can absorb 10 times the amount of vitamin D that they would have. So they are a wonderful source of vitamin D, a wonderful source. And so I like to do recipes with those. And you can easily do, some people use it and just slice those nice portobellos and stuff and make them into burgers.
Totally.
Quite a few products that you can get without much additives. I don't want people to use additives. I think if we got to the bottom line, that's my concern. But if you can use the natural products in the mushrooms, that's a great place. So beans, mushrooms, beans, like I said, just watch that gassy thing. Okay. Don't get too much into the greens. Be careful with your kales. You can cook them down, but raw, be careful with your cleansing. You're plenty cleansed if you've having stools 3 and 4 and 6 times a day. So don't get too much into your cleansing vegetables. Be careful with those. I have some favorites, so I try to get people to eat like a rainbow. So, that's our big thing, eat like a rainbow. So things that I found that are tolerated pretty well. We talked about the mushrooms already, so I'm not going to go through those. But beets tend to be tolerated really well. Braised beets, sliced beets, steamed. And I think that's a food that's under-eaten. Totally. Winter squash, both acorn and butternut, and the spinach one, the spaghetti one, are very nutritious, have vitamin A, are mild on the system and very well tolerated. Make great soups. They can be made sweet like a pumpkin. They can be sweet or savory, and so they're really a great food to start working with. I think that I like that one. English peas have a soluble fiber, and for people that are, especially people that are, it sounds kind of like, what is that? Well, if you're juicing, I've learned from some of my patients that if they'll use that English pea and that soluble fiber, it really helps decrease the motility. So I think some off-the-wall things like English peas, where it's a good carbohydrate source and good energy source and doesn't irritate the GI tract very much. Let me keep going down my list. Nut butters. I think nut butters are tolerated really well. Again, the fat, I like them natural because you can pour the fat off. Right. And then, because that'll keep decreasing the fat in it. And I think that helps. Legumes, we talked about the garbanzo beans. I think there's some white beans. I don't have as much complaint on the white beans as well. Black-eyed peas, I don't have as much trouble with. We use a lot of rice in Louisiana, but for places that don't use rice, it combines with your other proteins to make a total protein. So it's a good product to use as well, especially, beans and rice together make a total protein. Mm-hmm. Just usually those now, and if you've been using, everybody's different. I will say that. So if you're somebody that's tolerated the red beans or the pintos or the black, the problem is the gas. So if you're not having too much gas or diarrhea right behind it, you can use those beans as well. Okay. And sometimes that they may be made into burgers and processed a little bit differently. Sure. And once you puree something down, a lot of times you change the tolerance. So those things will work as well. Fruit. We know that strawberries have a little bit of history. They're tolerated pretty well. Some of the berries that may not be as much, but I think the melons tend to be tolerated. Find products that are lactose free. There are that you can tolerate. or get the lactate tablets that you can digest, you can chew or take before you have the foods, and that'll help tremendously. You may have to find an alternative to milk to still get, but I've had quite a few people successfully use an array of the new alternates.
There's so many new ones, yeah.
And rice milk's always been good. Rice milk is excellent, especially when people are having really their bad days. You can even I have recipes in these things of rice milk and rice punch, but it has, we still use rice milk in third world countries for the electrolytes, right? So these things can be used quite well. But main thing is seek out those enzymes. If you want to use regular foods, just get those enzymes that'll help you digest.